A stem cell transplant is used to treat cancers, particularly of the blood and the immune system. Let's start with what stem cells are. Stem cells are basically immature cells that are present in the blood and the bone marrow. They have the capacity to differentiate and recreate the bone marrow. All the three cells in the bone marrow, including the red cells, which carry oxygen to all the organs, white cells which provide immunity and help to fight infections, and platelets which help to prevent bleeding. Stem cell transplants are basically a way of trying to treat a number of cancers, and multiple myeloma is certainly one of them. So when we see patients with multiple myeloma in our clinic, we first assess them, and then generally if they require treatment, we will give them a combination of different drugs in what is known as induction therapy to try and reduce their myeloma cell burden and to reduce the risk of complications as much as possible. But because we know that myeloma is an incurable cancer, we then want to try and deepen the response as much as possible. And we do that with a stem cell transplant. So basically, we give such high doses of chemotherapy, a drug called melphalan, that we know that it's going to cross the threshold of dose-limiting toxicity. So what that means in lay language is that the dose of chemotherapy is so high that while it does attack the myeloma cells, it's also going to attack normal bone marrow to the extent that the marrow cannot regenerate back on its own. So really we need to harvest stem cells from the patient, give the high-dose chemotherapy, and only then we need to reinfuse the stem cells back to the patient. So that's how the patient's normal bone marrow can recover. The whole aim of this exercise is to try and kill as many myeloma cells as possible. After we complete the transplants, we'll generally follow this up with what is known as maintenance treatment. So again, we're just trying to give low doses of a particular drug or combination of drugs to try and keep the myeloma suppressed as much as possible and prevent it from progressing. Now, transplant is, depending on the source of the stem cells, it can be classified as an autologous stem cell transplant, which is more widely used in myeloma, or an allogeneic transplant. And basically the difference is that in autologous transplants, the stem cells are collected from the patient themselves, whereas in allogeneic transplant, the source of the stem cells from another donor. There are separate set of complications that occur with allogeneic transplant. It's a much more involved procedure, and there are fewer centers in Australia that do allogeneic transplants. Now, what I'd really like to emphasize is that the stem cell transplant in myeloma is really considered to be part of the initial treatment for fit eligible patients. So obviously it's not a procedure to be taken lightly. But if a patient is fit and below a certain age, and the age cutoff that we broadly use in Australia is age of 70 years. It's not to say that patients beyond that cannot have the transplant, but that's a discussion that patients need to have with their hematologists.